Yes, I am Elise Pratt, and I wanted to tell you a bit about our group before we get started. So we are the Robert Cizik Eye Clinic. That is where Dr. Chen practices. And we are part of UTHealth Houston, and as Elena said, the Department of Ophthalmology. So we have 18 providers in our group. So it's a large multidisciplinary group. We have a lot of interest in research and education and expertise across the range of different eye conditions and issues. So Dr. Chen is here. She is our oculoplastic surgeon, and she's going to talk to us a bit about some non-surgical things also that we could do to turn back the clock. So with that, I will let Dr. Chen start her presentation.
Hi, everyone. Thank you so much for joining me today. So my name is Ying Chen, and I'm one of the faculty physicians at UT Houston and also the director of oculoplastics. I hope that you all will find this interesting and informative, and feel free to ask me any questions you might have at the end. All right, so we'll get started. So the topic of our talk today is turning back the clock on aging. And I do think it is important for us to talk a little bit about aging and what kind of changes we typically see. So when we're young, the fat in our face is very evenly distributed. There are certain areas that's more plump in a youthful face, so such as the forehead, the cheek area, as well as around the eyes. If you look at all these beautiful celebrities, they tend to have fullness in all the right places. You can see even their makeup is done to highlight those areas of fullness, such as the cheek area. So what exactly happens when we age? With time, our skin, which starts off very plump, start to get thinner, drier. We also lose collagen. That's when you start seeing wrinkles and a loss of elasticity. The fat in our face that we talked about before also lose volume. And over time, it can also clump up and shift downwards with gravity. Meanwhile, other parts of our face start to gain fat where we don't want it, such as the lower half. So particularly, we can get baggy around the chin area, and we often see jowling with aging. Finally, our bony structure also changes with aging, and that contributes to an overall loss of volume. As you can see here, there are some visible signs of aging that includes like increased lines along the forehead, in your frown lines. You may also see the cheeks start to descend, as we talked about with a loss of fat and also with gravity. You will see more prominence in your nasolabial folds as well as the marionette lines and jowling, as we spoke about before. Even for those that have really good genes and look much younger than they are, these changes tend to be inevitable and are difficult to avoid. Of course, I always say these changes do reflect the joys and our challenges in life, and we do celebrate our age, but it is okay if we want to slow it down and even postpone some of these changes. So the big question is that what are some things we can do? What can we do to slow this down and preserve some of our youthfulness? The first thing I do want to talk about, which I think is incredibly important, is preventative care. Prevention is key. No matter what you decide is the best course of rejuvenation for you. So this can be really confusing because I know the number of products on the market is incredible, and they range from drugstore prices to Nordstrom and Saks Fifth prices. So this is more of a general overview, but I always start with a very good sunscreen. So the most ideal sunscreen is one that does not irritate your skin, and that in ideal world, you can apply every 2 hours, even indoors, especially for those who have big windows. Now, the next important routine for those who wear makeup, especially, would be a good gentle cleanser. After that is probably when it gets most confusing, is creams and lotions. So if you think about creams and lotions, think of it in two big categories of serums and moisturizer. So serum by itself usually is not enough to moisturize your skin, but it contains some very nice ingredients to help your skin. Some of the serums you may have already heard about and may have used in the past include niacinamide, which help your skin barrier by boosting ceramide production. You may also have heard about azelaic acid to help soothe some redness, as well as my personal favorites, antioxidants, including vitamin C and E. These are all really good ingredients, but the combinations of which ones to use will depend on your skin type and how well it tolerates. Now, lastly, this is a really important step that I really do recommend to a lot of people, is a retinoid at nighttime. It's really helpful in inducing collagen production, as well as to help decrease undesirable pigment spot that we accumulate over time. However, if you're new to the world of retinoid, you have to build up to it because it does make your skin very sensitive, and using a sunscreen is essential when you're on a retinoid. But lotions and creams, as we know, can only do so much. So if you're interested in a little more, there are other options, including injectables, laser, and surgery that can be very good options as well. We'll first go over injectables, which generally consists of the big categories of botulinum toxin and fillers that you may have already heard of. Now for botulinum toxin, it comes in many different brand names, and I'm sure the one that everyone is most familiar with is called Botox. Its role is to just temporarily diminish or eliminate lines and wrinkles on the face by relaxing the muscle that it is targeting. So other brand names that is very similar botulinum toxin would include Dysport, Xeomin, and Jeuveau, which is actually newer on the market. It came in the last couple of years. Now, botulinum toxin is very effective when used to address forehead lines, frown lines, and smile lines. In the right person, it can actually even help to do a subtle brow lift, which can be lovely, and to alleviate lines around the mouth. So I think the most feared thing about Botox is after you get it, people say your face just freezes. It's actually not completely true. It's all about how you do it. So these can actually get a really beautiful effect if you do it in the most natural way. It actually also works really well in treating TMJ for those of you who suffer from TMJ, which I do also. And what it can also do is some people have very prominent muscles. They're called masseter muscles right in the jawline. And a few sessions of botulinum toxin can actually also slim down your jawline and give you a really beautiful facial structure. Now, botulinum toxin in general, you see the result in about, you may start seeing in 3 days, but I would say the final result in about 1 to 2 weeks. It is not immediate. You do have to wait a little bit for the toxin to kick in and interact with your muscles. There is minimal recovery time, which is great. It's just a pretty fast procedure in clinic. You may have a little bit of what almost looks like mosquito bites for 5 minutes and they disappear. You can go back to your daily activities right after. Depending on the person, it can last between 3 to 4 months, but there are some new products that are coming onto the market that they're boasting it will last longer, but we'll have to see that. Side effects in general tend to be low as well, which makes it really beautiful, because if you didn't like the effect of one session of botulinum toxin, in 3 to 4 months, it usually is gone. But in general, there's not anything bad that really can happen with doing Botox. In terms of the next category is fillers. There are many different types of fillers on the market, but the goal of fillers really is to provide volume to the face, as we talked about, since we have a loss of volume over time. The type of fillers that we do need will depend on the area that is being treated. I'll go over the most commonly done fillers on the market right now is hyaluronic acid. So it can come in different brands, just like botulinum toxin. Some of the ones you may have heard of include Restylane, Juvederm, Beloterol, and also the newer one is the new RHA. As you can see here, people who get fillers can actually get a really natural result without the look of being overfilled that most of us are probably afraid of. However, I do tell everyone, it does sometimes take multiple sessions in order to achieve this result, because we want to let each session the filler to settle in before we add on more, so we don't get that stereotypical look of being overfilled in the celebrity world. Now, during your filler session, it is not uncommon to get some bruising and swelling. Usually it goes away in about a day or 2. In my experience, I think filler actually can last 1 to 2 years, depending on where you get it and the type. Some places that can actually last a lot longer, especially if you get it in the under eye. So the benefit of hyaluronic acid fillers is that if you don't like them, they are actually dissolvable. We can give a medicine that can dissolve it. As you know, sometimes your facial structures change, and then we want to decrease it. I believe Courtney Cox was the one who had her fillers dissolve, and it was all over the media. Now, I'm always very, very transparent about this, but fillers do carry a higher risk than botulinum toxin and creams and lotions for sure. There have been reports of those who lost vision and had skin necrosis after filler injections. That's why I always recommend anyone who's interested to do it with someone who has excellent knowledge in the surgical anatomy of your face and eyes, because it's very complex. The other type of filler that I love and I want to mention is called Sculptra. It's not a hyaluronic acid, it's a polyallolactic acid. It works differently because what it can do is that it actually promotes collagen regeneration over the next 6 months. So you don't see the results so much right away, but you do see it over the next 6 months that you actually make your own collagen that will stay. As you can see here, it really provides a beautiful job in slowing down the signs of aging. So we're going to shift gear just a little bit to talk about laser. Laser is also a really great option to treat a lot of signs of aging, some of which would include spots. So sunspots and also facial veins are very amenable to lasers. Other types of lasers can also treat fine wrinkles and stimulate collagen. There are more aggressive lasers that you may have heard about, like CO2 lasers, that are available for skin resurfacing. But that does depend on your skin type and has a longer downtime and may not be for everyone. One of the newer laser technology that is really exciting and is radio frequency microneedling. So it works to heat the skin just below the surface, which means that you don't have much downtime, and also it is amenable to all skin types and colors. It does often require multiple sessions, I would say about 3 or more, to see results. But not only can it improve skin quality and texture, but it can also tighten skin and smooth out fine wrinkles. Of course, all these things we've talked about, they all have their own specialty and very exciting, but sometimes we can do only so much with lasers and injectables. And there are things that surgery can be the better option, especially when combined with other interventions. For example, in droopy eyelid, in this person, you can see that she has pretty significant droopy eyelid on one side more than the other. And lifting her eyelids through surgery can give you a really beautiful and natural result to brighten up your eyes and your overall demeanor. And then the other surgery that I commonly do is the upper lip blepharoplasty, which is removal of upper lip skin. It can, as you can see, provide a natural result without looking overdone or looking very surprised, and it can brighten your eyes. This would not be able to be achieved with injectables and lasers alone. The other surgery I mentioned was lower eyelid surgery. A lot of times the puffiness in the lower eyelid is due to fat prolapsing forward as our fat with age starts coming forward, and that can be really bothersome. Surgery is the most effective way in treating this and actually can do even better if you combine it with laser. Okay, so we've talked a lot about different options, and you can see here, there are just so many available, and some of them I haven't even touched on. I do believe that the most ideal result is one that helps you look the best version of yourself, and that is going to be unique to each person. So the most important thing is to talk to your provider and find the best and also the safest option for you. So thank you so much for being here, and I will take any questions you might have.
Thank you so much. We have got questions, and if anybody has questions, just a reminder to put those in the chat window. If you type it in there, we will get to yours. We've got a question here, and also a request to speak a little bit louder, please.
Oh, I'm sorry. I can only hear myself, so just let me know. Yeah.
That's okay. I can hear you, but there was a comment, so I wanted to make sure I said it. Question is, what can we do to ease dark circles?
So dark circles is actually a pretty complex condition and it's different depending on the person. So dark circles can be due to a number of reasons. It can be due to some people have increased pigment under their eyes, just genetics, they're born with it. Sometimes some people have dark circles is actually because of the blood vessels are more prominent under their eyes because the skin around our eyes is the thinnest skin. So that sometimes can be treated with vascular lasers. So as we talked about, the lasers that can decrease the vascular that you see from beneath. And then lastly, sometimes dark circles is just due to volume loss. So what we see is a little bit of hollowing. So it's what you actually end up seeing the darkness is from creating a shadow and not so much because there's more pigment or if there is vasculature underneath. In those cases, fillers actually do really, really well for dark circles. So it just all depends on what is the reason, and it can be a combination of factors as well.
Okay, excellent. Another question, what can you do about jowls?
Jowls is hard. So it depends on what point the jowling is at in a way. Is that when you have just a little bit of jowling that you see initially, fillers can actually help to lift up the cheeks. So believe it or not, if you lift up the cheeks, it actually also helps your jowling. And sometimes we put a little bit of filler just right around the jaw area, especially for people who don't have very prominent jaws. It also can hide the jowling. But for more significant jowling, those tend to be, you don't want the filler to migrate into your jowls and make it worse. So if that is the case, then there are a couple options. One is that some people, if there's a significant amount of fat, you can do lasers to melt the fat away. But I think the more effective option in this case would be surgery.
Okay, perfect. How does skin tone / ethnicity play a role in what options would be a better choice? So in general, it seems.
Yeah, it definitely will, because in your skin tone, I think the one that is going to be most effective would be lasers. There are certain lasers where for paler skin tone, like for example, the palest we will always say is the redheads, right? Those tend to have less inflammation after lasers. So they do better with lasers, especially the aggressive lasers. And then for darker skin tone, what happens is when you use laser, there's something called post-inflammatory hyperpigmentation. That means that your skin, when it's healing, actually can gather more pigment, and that's not what you want. So depending on your skin tone, that can affect especially the type of laser you can get. However, skin tone can also determine how likely you respond to different sort of treatment and creams. I would say that for the preventative care, that applies probably across all skin tone. And then for surgery, we have noticed that sometimes based on ethnicity and skin tone, people have different ways of healing. And even within the same ethnicity, you may heal differently. So all of these should be considered when you're looking into your journey. And sometimes you do need to try things to see what really works the best for you.
Excellent. I do see there is one participant with a hand raised. If you could put your question, type it into the chat window, we can get to it. I have this question too. Please talk about the side effects of retinoids and how to, I guess, ease the reactions such as skin irritation and redness.
Yeah, so that retinoid, I would say that retinoid, that is a great question because it makes your skin very, very sensitive. The stronger it is, so there are many different strengths. There are ones that are just over the counter that you can even buy. There are ones that are prescription strength and they can go up to pretty strong. So I would say that number one is to try for a lower concentration and then not to use it every night, but to use it every 2 to 3 nights when you're starting. Okay. Moisturizing is going to be very important. If you're having reaction to retinoid, I would not add that much other types of ingredients. So I would say that start with a retinoid and a moisturizer, see how you do it every 2 to 3 times a week, and then you can build up to more frequently. If you're doing well with that, then it should continue to, your skin will start to tolerate it better and better. The other thing I talked about is the sunscreen. it's going to make your skin so much more sensitive to UV light. So the sunscreen is something that has to be done every single day, and try to be, try to have it next to your desk or in your purse where you can just put it on, especially in the afternoon sun when it's really strong, because that can also contribute to the sensitivity of the skin.
Okay. This is, I think, harkening back to, Botox, asking what is the context for TMJ that was mentioned?
Yeah, so when you have pain from TMJ, what the Botox does is that you actually can relax one of the muscles that help you bite down, and also the muscle that controls the joint. And so if you relax a muscle, and we never freeze that muscle completely because it's actually a big muscle, it takes a lot of Botox to completely freeze it. So I actually have TMJ and have gotten Botox to treat my TMJ. And because TMJ, as you know, the treatment options is usually like night guard. And then if not, then some people even need surgery. So I wanted something minimal, and it has worked really well for me. What it does is that it relaxes the muscle, because TMJ worsens when you clench your jaw or when you grind your teeth at night. And when that muscle is more relaxed, it actually puts less pressure on your joint and helps with the pain. The side effect of that is that if you have really prominent jaw muscles right here, then it helps to slim your face. So it's not an undesirable side effect.
Right. Awesome. Yeah, we had a couple questions about TMJ, so that's great.
Okay.
What do you think about eating collagen peptides? Small pieces of collagen, which may make your body make more collagen.
So there's not great science that shows eating collagen will help it go to places that it needs to go. I think that I always say about vitamins, usually it doesn't hurt you. If it feels like it's helping you, especially you have good effects for your skin, it doesn't hurt. But I don't recommend it routinely because it's extra, it can be pretty pricey, and there's just not perfect science behind it.
Okay. What about collagen creams?
Collagen creams, so like hyaluronic acid, which we talked about, is in fillers, but hyaluronic acid also comes as a serum that has shown to work really well. So like I said, it's all going into the creams and lotions. Try different things to see what combination works for you. If it's irritating you, you know that's not for you. But then if you're feeling like you're having good effect with hyaluronic acid or collagen cream, then of course I would say go for it. The thing is that I personally like to use serums and cream that has more scientific research over it. So more of the dermatologic types of cream is what I like. I know that, there are many different really fancy creams that they sell at drugstores as well as at department stores, but it's just that their science is a little hidden. So I never know if their effect truly is scientifically proven, but typically if you look on some of the dermatologic grade creams and serums, they work very, very well, and there's science that back it up.
Excellent. Okay. Can you please talk more about the process for surgery for droopy eyelids?
Yeah.
How long does the hospital stay, and when do you go back to activities?
Sure. Yeah, I went very brief, but I'm always happy to answer any questions because that's what I do every day. So for droopy eyelids, I think it depends on what kind of droopy eyelid you have. So we come together and kind of seeing what type of surgery works the best for you. So there are really two main types that cause your eyelid to droop. One is that you have excess skin. As you know, your skin loses elasticity, and then it can stretch down and then give you that droopy eyelid look. The second one is that some people's eyelids just tend to droop over time because the muscle that helps us open our eyelid is not as strong and tends to just get stretched out, especially if we use contact lenses and things like that. So the surgery itself, depending on type, I would say can range between like 1 to 1.5 hours for upper eyelid. It actually doesn't take very long. It can be done in an outpatient setting. So you have the option of either having a little bit of anesthesia, so a little bit of happy juice, but nothing like general anesthesia, or some people will be okay with just taking a Valium, so they feel nice and relaxed. And then we do local anesthesia in that area. Surgery is done, like I said, in about an hour and a half, and the downtime is actually not very long. I say bruising and swelling is inevitable because we did do surgery. That is the worst at day 2 and 3. But after that, you honestly can go back to doing whatever you want. Only thing I ask for is that don't go lifting 200 pounds for me, and also don't go swimming for about 3 weeks, just because I never know what's in the pool. But other than that, you can go back to like shopping, you can go read, you can go back to work, anything you want. Yeah.
Okay, awesome. Well, I don't see any other questions. If you do have questions, you can put them in the chat, or I think if you're in touch with Elena, you can send them to her and we'll get them to Dr. Chen. I've put our contact info. So if you were interested in learning more about our group or making an appointment with Dr. Chen, feel free to call, email, or go to our website. And Elena, thank you so much. And thank you, Dr. Chen.
Thank you for having me here.